Well, so far we've recorded in this epidemic about 8,000 cases and almost 4,000 deaths. We know that that's an underestimate. We're seeing presently about 1,000 cases a week, and that may well still be rising. So we're expecting the total number of cases and the total number of deaths in this epidemic to run into many thousands. The epidemic is still very far from under control. We're seeing persistent transmission across the countries that are most affected, Guinea, Liberia and Sierra Leone, and especially in the capital cities of those countries. And we have a great deal of work still to do in order to turn this epidemic around.
Is there now anything like the level of help, both locally and from international agencies and governments on the ground in those countries?
The level of help that's being provided is nowhere near large enough yet. For example, in Guinea, we've got about 3/4 of the bed capacity that's needed, but in Sierra Leone and Liberia, it's far less than that. Our assessment is that less than a quarter of the clinical and hospital capacity is in place compared with what is actually needed. It's getting better. We're putting in place more clinics and hospitals. We're putting in place improved mechanisms for care in the community. But we still have a long way to go to provide all the facilities that we'd like to be able to provide to all three of these countries.
And what is the most urgent need? Is it money? Is it people? Or is it indeed people with the requisite skills?
It's all of those. The international response effort has come up with a substantial amount of funding, but more of that is welcome. But what is particularly needed is coordination on the ground. There are now many people involved in the control of these outbreaks in the three different countries. With effective coordination, we know that we can put in place the measures that were needed for infection control, that is early case detection, patient isolation, proper patient care, and particularly safe burials, which is an extraordinarily large source of infection to people in the community. And if we do all of those things, we're certain that this epidemic can be turned around. We're confident because of the experience that we've had from past Ebola epidemics. Although this one is extraordinarily large, the essential principles of control hold true. And if we can put in place the measures for infection control, this epidemic will die away. The problem is getting all of those in place on the ground, coordinating the resources that we have, getting more people in place, expert people in place, and also putting them in place and making sure that they're safe themselves in this very large control effort.
And burial, you mentioned burial there. Culturally, that's one of the most difficult areas, I understand.
Yeah, that's right. Local people have burial practices and they're reluctant, very understandably, to give up those practices. And what's therefore very important in this epidemic is that we at the World Health Organization and other external agencies are not simply seen as outsiders coming into these communities and telling people what to do. This has to be done in partnership with the local communities and very much with local leaders to explain to people and to get an understanding of the risks associated with traditional burial practices, and then to begin to change those practices, but very much not by imposition, and very much in partnership and with the full agreement of those local communities.
How do you rate the chances of an outbreak beyond the borders of the three countries which you've named?
The chances of an outbreak in European countries and North America are not zero, that's clear, but they're also very small. In most parts of Europe and North America and other similarly well-resourced countries, it's very clear what we need to do with respect to infection control, and by and large, those procedures will be put in place quickly. As for other countries surrounding the ones in West Africa that are currently affected, we do have some concerns. For example, a substantial number of the cases that are reported to us, both from Guinea and Liberia, are in bordering areas of Côte d'Ivoire. We haven't had any reported cases yet from Côte d'Ivoire, but this is the sort of place where cases could well turn up, and we're extremely vigilant about the infection crossing the border at that point in Africa.